Hello everyone. Today I'm going to continue the last topic which what we discussed. So regarding the coordinations and coordination training here. In the last class we discussed regarding the what is the coordinations, what are the causes of incoordination, impairment of the coordinations, and also what are the different type of the coordination skills, and also what are the major structures are responsible for the coordinations, what are the signs and symptoms of the cerebellar injury, how to do the assessment of the coordinations. So in this topic today we are going to do the how we are going to give the trainings who are having the impairment in the coordinations. So we are going to discuss it especially. So these things first, in the yesterday class we discussed about the assessment of the in coordinations. Today we are going to discuss about the how we are going to manage the in coordinations. So these things are going to be, so especially if in case of any patients comes with the ataxia, so which is nothing but is a unsteady gait or loss of balance and nystagmus. So yesterday we discussed what are the important signs of the ataxia. So if any patient comes, so how we are going to manage, how we are going to treat the patients. So with how we are going to rehabilitate, how we are going to strengthen their muscles. So all these things we are going to discuss in this topic. First thing is, so we have to prepare a goals for the ataxic patients. So the goal should be is the long term goal and also short term goals. So the long term goal should be so independent as much as possible. We have to make to the patients independent as much as possible. Independent means if they want to do any activities from sitting to standing, from the standing to walking, or if they want to reach the overhead activities, are independent activities. So all the ADLs should be is the independence, should not be dependent on the family members or caregivers. So that is a long-term goal. So and also the short-term goal should be so improve the proximal stability. So because of is a imbalance in the loss of the balance, so they may chance to lean forward and also may chance to get the stoop postures and also may chance to get the weakness in the proximal stability. And also how to do the improve the eye hand contact. So that is the skills. So it's together should be is the gross motor functions as well as the fine motor skills should be is combined together, and also how to improve the is the eye hand contact movement. So that means how to concentrate on the object and also has to hold the object if they get anything, if we hold anything object. For example, if anybody throw a ball, so they have to concentrate with the eyes and also how the ball is coming, in which direction this ball is coming. So then how to hold the ball. So this should be is the like a eye and contact skills. So this type of activities, and also using the mouse and also sewing, application of the any thread and also into the needle, how we are going to be insert the needle into the thread into the needle. So these type of activities we are going to be, we have to improve in the short term goals, and also regain coordination by regulating the interplay. So that means we have to bring back into the normal coordination skills. So with the special like exercise and also special trainings. So between the agonist and also antagonist. So depends upon the agonist muscles, that is the main muscles, and also opposite muscles also we have to concentrate. So depends upon the strengthening of the agonist and antagonist muscles, we are going to prevent the weakness in the proximal muscles. So it leads to the is a strengthening in the proximal stability, and also enable the patient to control movement against the gravity. So we have to control the maintain the stability is against the gravity. So these things are going to be our short-term goals. So if we do if we reach the short-term goals, and also we have to concentrate on the long-term goals. So these are the important goals if any patients having the ataxia. So these treatments, so ataxic patients are going to be, so we are going to manage and also we are going to improve the coordination, the specialized exercise regimes, so also called as is a Frenkels exercise. So these Frenkels exercise is nothing but is a coordination, and also is going to be increasing the balance and coordinations. So especially, so these exercise, the first is invented by the Dr. H.S. Frankel. So is a Frenkels. So he was the physician, Switzerland physicians, who aimed to establish voluntary control of the movements by use of any part of the sensory mechanisms which remained intact, is notably slightly sound, touch, and compensate for the loss of the kinesthetic sensations. He is the physicians. So he's a Switzerland physicians. He invented these exercises, Frenkels exercise, especially for the tabes dorsalis, who already having the a loss of sensory and loss of coordination movements, who are having the tabes dorsalis. So first they invented. So after that is used to the who are having the incoordinations and also loss of balance problem. So these examples are going to be, so these exercises are going to be, is mainly should be rhythmic, and also should be the voluntary, is going to be improve the voluntary action in the patients. But while giving these exercise, how to give the, we have to give the some special precautionary measures, and also we have to provide the proper vision to the patients, and also we have to give the some sounds, some commands how to give, so touch and also commands. So these are all activities are going to be compensated the is kinesthetic sensations. So kinesthetic sensation means, for example, if anybody having the loss of kinesthetic sensations, especially now we can, if we are normal persons, so if they close the eyes also, we can know the what is the movement we are going to do, we can understand without seeing the movement. For example, if I close my eyes, so if I do this is the wrist extension and wrist flexions, so I know the movement. So this movement I can understand without seeing the movement. So that means I have the kinesthetic sensations. But in case of the loss of, yesterday we discussed regarding the this loss of the coordinations, especially in case of the spinal cord injury or cerebellar injury and peripheral nervous system injury, so may chance to get the kinesthetics, loss of kinesthetic sensations. So who are having loss of kinesthetic sensations, so these Frenkels exercises are going to be increasing the coordinations and also balance, and also improving the kinesthetic sensations. And these Frenkels exercises are series of motions of the increasing difficulty performed by the ataxic patients to facilitate a restoration of the coordination. So these exercises are going to be the series manner. So it's going to be sequence of the activities is a very difficult to do by the ataxic patients. So if we give the proper training, so with these sequential orders of exercise, so we are going to be increasing, or we are going to facilitate the coordination movements in the ataxic patients. So these exercises are used to bring back the rhythmic, smooth and coordinated movements. So these exercises are going to be helpful to increasing the and also rhythmicity and also smooth and coordinated movements in the cerebellar injury patients or who are having impaired coordinations. So according to this Frenkels exercise, so it was originally developed in the 1899, 1889 to treat the patient with the tabes dorsalis, so and also problems of the sensory ataxia owing to the loss of proprioceptions. Proprioception means loss of joint position sense. So this Frenkels is a physician, Switzerland physicians. He invented these exercise, series of exercise, especially for the tabes dorsalis. So that means we are having the loss of proprioception. Loss of proprioception means joint position sense. So it's also interrelated to the kinesthetic sensations. So these are also proprioception. Also, we have to know the joint position sense. If they close, if we know the movements of this is the finger movement, this is flexion and extension, we can understand. So if you are normal persons, but who are having the posterior column lesions, especially in the spinal cord area, in the spinal cord injury, if you see the cross section of the spinal cord, so anterior columns and also posterior column, if you see the cross section of the spinal cord, you can see the head shape of the gray matter and also white matter. So if any columns, any lesion in the posterior columns, such as the fasciculus gracilis and fasciculus cuneatus, so if any injury in these tracts, so it may chance to get the loss of the proprioceptions. So especially in the tabes dorsalis, so it's a neurological conditions. So those people may chance to get the loss of proprioceptions and also sensory ataxia. So these exercise first is used for the especially for the tabes dorsalis patients. So these exercises have been applied in the treatment of the individuals with the ataxia, in particular the cerebellar ataxia. So many different type of the ataxias are there. So here is going to be especially who are having the incoordinations. So these Frenkels exercises are going to be enhance the functional activities, improving the coordination activities who are having ataxia. So these exercises are performed in the supine lying position, sitting position, standing position, and walking positions. So each activity performed slowly with the patient using the vision to carefully guide the correct movements. So we have to give the training in the sitting positions and also in the lying positions, standing positions, and walking positions. Each positions we have to give the different of exercises. So each has to give the we have to give the some like a clues, or maybe we have to give proper training to the patients. So if we train properly, so they are going to improve the coordinations, and also they can maintain the balance, and also is a rhythmic, and also is going to get the purposeful movements, is going to be accurate movements. So these exercises requires a high degree of the mental concentration and also effort. So while practicing, because of they have to observe, so what type of activities are doing, so how the movement is takes place, so and also how to concentrate, and also how to put more effort. So then only they can go. They are going to get the initiation in the movement because of the loss of quad. So yesterday we discussed regarding in the last class we discussed about the for example dysmetria, hypometria, hypermetria. So this means so unable to reach to the exact point. So for example, if any task is here, if you try to ask them to touch the finger here, finger to finger, so who are having the abnormality, hypermetria, so they are going to cross the finger here, so they are going to searching for somewhere after the after the finger placement, after the task, the so this type of problems we are going to find. And also initial loss of the movement, so because of the hypotonia, unable to do the perform the movement. So in those conditions, the patient has to put more effort. So for those patients with prerequisite disabilities, so they may be helpful in the regaining control of movements through the cognitive compensation strategies. So who are having the difficulties to do the movements, or if they are unable to concentrate, or if the less effort, so we have to train properly. So how to do the compensatory actions, for example, so we have to give the some prerequisite abilities. So we have to train them. For example, if the vision is not proper, or if they are in coordination. So in those conditions, we have to train before the activities. We have to show the how to perform the activities, how to do the activities. Then only we can give the some sessions. We have to like a demonstration, video demonstrations with the patients, or live demonstration with the patients. So these things are going to be helpful to participate in the Frenkels exercise. Patient with a partial sensation can progress to the practicing exercise with the closed eyes. So yesterday we discussed, in the last class, we discussed about the assessment of the coordination with eyes opening assessment, and also after the eyes closing assessment. So that means that if you see the rhombus sign, so we have to train them. So with eyes open the activities, and also narrow base support with eyes opening, and also with eyes closing. So this type of activities are, if we train properly, so we are going to enhance their functional activities. So coming to the major principles of the Frenkels exercise. So the major principles are the 6 principles are there. So these 6 principles are the concentration, precision, speed and range, command, repetitions, and compilation. So these principles are very important while giving the Frenkels exercise. So what these 6 principles we are going to discuss here is one by one here. So concentration. So this is the very important. The patient has to concentrate what we are giving the exercise and how we are giving the exercise. So the patient has to be positioned to watch every movement which he performs. So the patient should be active. So then only the patient can learn how the movement is getting. So that means, so the patient should be awake, and also the patient should be alert. So that's the reasons we have to give the normal positions, especially the half-lying position is suitable while giving this Frenkels exercise. The patient must give full attention on the movements which he performs. So he should concentrate. For example, if he bending or if he dragging the leg, or if you're dragging the heel towards the buttock region in the supine lying positions, he has to observe how the leg movement, how the knee flexion coming from the extension position to the flexion positions. So if he observe the movement, so he is going to recognize the image, and also he's also going to give the feedback, so visual feedback as well as the movement sensory feedback. So both are going to be getting the improvement. So that's the reason the patient should be alert and also concentrated. So this attention of the movement may create the proprioceptors activities over the joints. So this most commonly we are having the loss of the joint position sense. So that means a loss of proprioceptions. If we give these activities with the concentrations, if the patient concentrate the activities, so he is going to feel the movement in the joint. He is going to feel the sensation, that is a proprioception sensations. The visual watching, the movements are the recorded in the brain. It may provoke the kinesthetic sensations. So because of this visual feedback is going to be recorded in the brain. So this recording is going to give the kinesthetic sensations. Regular movements of the joints also may induce the proprioceptor activities. So if they practice regularly, if they watch regularly, so it's going to be recorded in the brain. So this is going to improve the kinesthetic sensations. So that's the reason concentration is the important principle in the Frenkels exercise. Coming to the precisions. So these precisions, so the movement should be accurate and also rhythmical. So it should be accurate and also it should be rhythmical. It should not be jerky. It should not be inappropriate. So and also there should be not be any jerky movement, any arrhythmic or inaccurate movements. So that is the reasons. So the patient has to concentrate and also how we are giving the rhythmic movements and also we are giving the accurate movements. The patient have to understand. So the same thing have to practice. So because of the movement which the patient perform will be recorded in the brain throughout the visual pathways. The alternative sensory pathway will set the demands of the movements which the patient performs. So automatically, if we watch and also if we observe the movement clearly, this is going to be recorded in the brain. So it is going to give the visual pathways and also it improves the kinesthetic sensations and also improve the coordination. Speed and range. So this also very important. The quick movements needs to less control than the slow movements. So the patient able to do the quick movements, but if you ask the slow movements, so it's difficult to do the movements. So that is the reasons. So first we have to start the quick movements. So if the patient able to do the quick movements means he can control and he is going to do perform the activities. So normally slow movements are recommended to perform by the patients. So that is the reasons we have to encourage the patients to do the slow movements. The speed should maintain the slow and in even tempo throughout the exercise regimes. So if they follow the rhythmic movements and also slow maintained movements, so it also going to be maintained throughout the range of movement. The larger joints are concentrated more than the smaller joints, and also big movements are concentrated in the small movements. So that is the reasons. So what are the large movements are there? We have to ask them to do the like a slow movements. So this is going to be increasing the visual pathways and also recorded. So it also going to be increasing the coordination. Selected attained range should be reached during the each and every movements accurately and slowly. So we have to train. So each and every movement, for example, if you take the wrist joint, if you give the movements, we have to give all the movements. For example, the wrist extension, wrist flexions, and also radial deviations and ulnar deviations. So we have to give each and every movement. We have to train. So if they practice in the same patterns, so it is going to be increasing the concentrations and also is going to be helpful to increasing the kinesthetic sensation. So the therapist directs speed by using the commands and also using hand counting numbers or by using music. So while doing the patients, so the therapist has to give some like a command. Okay, you are doing good. So can you move to right or can you move to left? Can you do it some more or bit further? So if you give the commands, so the patient is going to respond according to the commands, or otherwise, so if the patient is able to do the holding any object. So if any object, so the patient has to, okay, if the holding any object for 2 seconds, okay, if you count 3, 4, if therapist counting, the patient is going to respond. That means, okay, you can hold at least a minimum like a 5 until the 5 seconds. If otherwise, if you are not responding, therapist is not giving any commands, the patient is going to try to hold within 1 or 2 seconds, is going to leave the object. So that time is the progression will be less. So the command is very, very important while giving any exercises. The range will be selected depends upon the functional useful range, so which is the normal day-to-day activities. So depends upon the person to persons, so the range will be different. So that means we are having the muscle strength. So what is the muscle strength? Is it the grade 3 or grade 2 or grade 4? So depends upon the muscle strength, and also we have to check the muscle strength according to their range. The therapist has to change the like exercises according to the strength and also their range. The range need not to be fullest range. Selected range movements indicated by the marking the spots over the couch or the therapist placing the finger in the air. For example, if the patient is doing the hip flexion, so in the supine lying positions, in the hip flexions, if the patient is doing the hip flexion. So for example, while giving the exercises, so if you draw pictures here, 1, 2, 3, 4. So if you ask them to in the supine lying positions in the complete extension of the knee joint, we can ask them to, okay, can you try to bring it up to 2? So from 2, can you bring it to 4? So that means if you give the therapist, if the therapist gives the command, so the patient also has to follow according to therapist command. Or sometimes without numbering also, or if the patient is supine lying positions, so same thing, the therapist has to put the hand in the air. So ask them to try touch the hand in the air, or maybe you can change the direction here. So the patient is going to try to lift the leg up and is going to try to reach the therapist hand. So that means he's going to get the slow and rhythmic and also controlled movements. So it may use the strengthening to the limbs with the Frenkels exercise. So this type of the training is important for having the impairment in the coordinations. So coming to the commands, command is very, very important. So these commands are going to be increasing the strength of the patients. And these are going to, the auditions is another source of the sensory mechanisms to compensate the proprioceptive activities and also involuntary movements. So if we give the commands, the patient is going to be alert, and also if any involuntary movements, he is going to be control the involuntary movements, or sometimes he is going to be respond so according to the joint position sense. Commanding is a very much necessary source to progress the activities. So if we give the proper commands, we can get the progression easily. The patient can also understand so where they're having the lacking, and also they can follow. So for example, if the patient is able to do only 50 degrees of the elbow flexions, if you give the command, can you do some more? Can you do some more 10 degrees? Some more 10 degrees. So or maybe another 5 degrees. So if you give, or try to reach your shoulder, or try to reach your opposite shoulder, try to touch your nose. So if this type of commands, the patient is going to be, at least if they are unable to do, if they're going to try to reach they follow the commands. If they follow the commands, so it also automatically is going to increasing the strength in the muscles, and also is going to increasing the range of movements. So with the command, we can alter the speed and range of movements and which the patient get performed. So that means the command, that's the reasons. So sometimes the patient is going to be lazy, the patient unable to perform the movement. But if you give the command, okay, you are doing very good. So I have to do some more 10 degrees. So can you raise up? So that the patient is going to be alert. So is try to do, if there is no movement also, is at least try to do at least 2 degrees or 3 degrees or 5 degrees of the movement. So it may enhance the progressions. So all these instructions are mostly given by the form of command in the exercise regimes. So that is the reasons command is the important to improve the progressions. So coming to the next one is the complexity. So complexity is introducing in the exercise regime is going to be improves the coordinations as well as the proprioceptive activities. So it may increasing the concentration, power, and also memorizing capacities of the brain and particular movement patterns. Complexity made by commanding the patients to touch the specific number mark alternatively. So that means while giving the training, so we have to show what we are doing the activities. If the patient see the series of the activities, so if you want to do for example, the hip flexions, so we have to show how much the hip flexion should be. So from the extension positions, if the patient leg straight, so if we can ask them to the neutral position to drag him to the 1, 2, 3. So if we give the command or complexity, so if you want to need the hip flexion or knee flexion 90 degrees. So if we give the knee flexion 90 degrees, so the patient cannot unable to understand. In those conditions, so we have to show, okay, drag until to the 2, and 3 and 4. So if they reach to the 4, so automatically the degrees are going to be. So these are going to be like a combined together activities. It's a complexity. So because of this the combined together activities. So we are going to get the receive the like a full movement. So nothing but what we are going to need, so we can get the purposeful movement until the 90 degrees of the knee flexions. So this type of activities should be we can get through the complexity training. And also repetition also important. So because of the practice, repetition means the practice nothing but the patient has to practice until the accurate movement performed by the patients. So these are when if they repeat and also if they practice prolonged time, so it will get the improvement perfectly. And also this also one disadvantage is that sometimes it may chance to get the fatigue and also may chance to get the tiredness. So the repetition of the accurate movements improves the kinesthetic sensations and also coordinations. So these exercise will be discarded whenever the patient feel tired. So if the patient feel tired or fatigue, immediately have to stop the practice and also repetitions. Frequent rest period must be allowed and repeating the movements are helpful for the cerebrum to the record, the memorize the particular movements preferably. So if they practice, okay, if we give the training, okay, 3 sets or 4 sets. So in between the sets, so the patient has to take the like a rest. So then only they can understand. So what is the normal movement? What is the abnormal movement? So then only if they get the resting positions, so automatically the brain receives the signals. So which one is the active movements and also which one is the resting positions. So it will give the feedback automatically. So that is the importance of the repetitions. So these are all are the principles while giving the coordination exercise through the Frenkels exercise.